When we embarked on our CSR programs last year, as always, there was a sense of excitement and urgency since there were several goals to be achieved. We wanted to expand the reach of our flagship healthcare and education programs through innovative models and means. We wanted to focus on research and advocacy, and it's been a full year for us, one that has been challenging but very rewarding. We have a lot of positive outcomes to share. Beginning with program Hope, the next segment would be showcasing the outcomes of all our programs.
If we expect working class and poor, especially from rural India, to come to the city for detection of cancer, it is not going to happen in India. We have to reach out to them in their own town, preferably at their own household.
Cancer happens to be a fear-evoking word. So what we try to do is we soften our approach. We say that we're doing a non-communicable diseases screening. We would like to check you up for a range of other issues. For example, we screen them for diabetes, for hypertension, for anemia, their vision. So there's a whole range of other tests which is happening. And amongst them, we will also be doing a oral cavity examination. We will be looking at breast health examination, and that's how we try to position the program.
Hope NCD screening is a continued effort of NHCSR team focusing on various multi-level measures, leveraging on technology, innovations and behavioral change communication as cornerstones towards a robust strategy addressing NCD in the wake of COVID-19.
There is a disproportionately higher incidence of cancer among young women who are in a productive period of life. We thought if we launch a program, first create an awareness, then reach out to vulnerable women and men also, we will be able to contribute significantly.
Suposhan program aims at iron fortification and supplementation to government school children in rural Rajasthan to address the burden of anemia. It was launched as a pilot intervention in collaboration with Britannia Nutrition Foundation, National Health Mission and Jaipur Education Department. NHCSR team aims at working towards a sustainable fortification program to decrease anemia among students. With the consumption of iron-fortified biscuits, the chances of having anemia was reduced by 75%.
हमें ये बहुत अच्छा लगा, शानदार लगा और इससे हमें एक शिक्षा मिलती है कि हमें रोज़ाना मेथी, पालक और बथुआ और दाल खानी चाहिए जिससे हमारे शरीर में खून की कमी न हो और हम एनीमिया रोग से ग्रसित न हो.
The Safe School program is about adverse risk behaviors in adolescent students. The pilot project was launched in association with Consortium for Tobacco-Free Karnataka. The project is aimed at creating awareness on tobacco, alcohol and substance abuse apart from addressing mental health issues. A large cross-sectional survey of more than 6,000 high school students revealed around 60% of them were too thin for their age. 5% of the students had smoked a cigarette between the age of 7 and 16. Over 4% students had drugs 1 to 10 times in the last 1 year. It was also found that initiation to alcohol consumption is higher among adolescents in government schools than private schools.
ನಮ್ಮ ಮನೆಯಲ್ಲಿ ಬೀಡಿ ಮತ್ತು ಈ ರೀತಿ ನಮ್ಮ ತಂದೆ ಕುಡಿತಾ ಇದ್ರಿಂದ ಮತ್ತು ನಮ್ಮ ಮನೆ ಪಕ್ಕದಲ್ಲಿರುವಂತಹ ವ್ಯಕ್ತಿಗಳಿಗೆ ನಾನು ಅವ್ರಿಗೆ ಹೇಳಿಬಿಟ್ಟು ಪ್ರೋತ್ಸಾಹ ಕೊಟ್ಟೆ. ಈ ರೀತಿ ಕುಡಿಯೋದ್ರಿಂದ ನಿಮಗಿಂತ ಪಕ್ಕದಲ್ಲಿರೋರಿಗೂ ಸಹ ಹಾನಿ ಉಂಟಾಗುತ್ತೆ ಮತ್ತು ನಿಮಗೂ ಸಹ ಹಾನಿ ಉಂಟಾಗುತ್ತೆ. ಈ ರೀತಿ ಕುಡಿಬೇಡಿ ಅಂತ ಹೇಳಿಬಿಟ್ಟು ನಾನು ಅವರಿಗೆ ನನ್ನ ಸಹಾಯ ಹೇಳಿದೆ.
Engaging school students as change agents to improve health-seeking behavior among adults. Envisioned by Dr. Devi Shetty, this unique initiative was executed in collaboration with Biocon Foundation, Syngene and Agastya International. 90 students were selected from 14 government high schools and trained on measuring BP. This unique initiative will be scaled up and taken to other locations. Higher educational scholarship programs such as Udair Pathe and Udan were launched in rural parts of West Bengal and Karnataka respectively. The program has enabled scholarships for NEET medical entrance coaching and mentoring among aspiring students from disadvantaged socio-economic backgrounds. These students have the advantage of being mentored and motivated by a panel of doctors from Narayana Health. Teach Summit is a collaborative symposium of Narayana Health's Care Companion program in association with Noora Health. It showcased best practices and insights in patient communication across diverse healthcare facilities. The program undertakes in-hospital education-cum-training for patients' family members, empowering them to clinically manage the patient at home after discharge. A community radio station was established in 2017 at NH Health City by Narayana Hridayalaya Foundation. Since then, Namma Nadi 90.4 FM has been airing community-based programs for the people in and around Anikal Taluk. During the COVID pandemic, we have been able to record and broadcast segments on a wide range of issues around prevention, immunity, nutrition, as well as mental health. From the start of the lockdown period, CSR team has been reaching out to the community and disseminating various informative messages on COVID-19 awareness. Webinars to create awareness on COVID-19 with safety recommendations was rolled out in 17 states across India in 7 different languages. Lots of myths were cleared and participants felt confident in taking safety measures. Amidst the COVID pandemic, Narayana Hridayalaya Charitable Trust, with generous support from various corporate and philanthropic partners, distributed ventilators to government hospitals in Delhi, Gurugram, Kolkata, Kochi, Mumbai, Pune, Hubli, Raipur and Lucknow. With support from Ashraya Hasta Trust, NH teams were able to engage in the Amphan Cyclone Relief Program during June this year. Our teams coordinated relief measures on ground with support from local NGOs and Panchayat officials. Relief materials were carried in trucks and boats across the river. 5,000 food packets with provisions were supplied to around 20 most affected villages in South 24 Parganas near Sundarbans in the midst of COVID.